All right, everybody, Dr. Rafich here from Vet Triage. We are starting off with this issue of Veterinary Surgery, November 2024, so a fairly recent issue. You'll notice with Veterinary Surgery publications, they are way more detailed, these experiments, and in depth than JAMA is, so these tend to be longer studies, but also much more thorough. This study comes out of the veterinary school in Georgia. The effect of hydrocolloid-nitric oxide wound dressings on wound healing in dogs. The objective is to determine the rates of wound healing in surgically created wounds between nitric oxide releasing wound dressings and control wound dressings. Prospective controlled randomized experimental study using 6 purpose-bred adult male beagles. Purpose-bred means they bred these dogs for the purpose of the study. The methods were 4 2x2 centimeter wounds were surgically created on the trunk of each dog, and each wound was randomized to treatment with either nitric oxide wound pad, nitric oxide wound gel, plain hydrocolloid wound dressing, or telfa pad. So they're comparing those 4 treatments on wounds that were experimentally created surgically. Wound images were taken daily for 8 days and every other day until day 21. Total wound area, percent contraction, and days until granulation were calculated. Results. The time to first appearance of granulation tissue was significantly shorter for the nitric oxide wound pad, which is 3.2 days, than for the nitric oxide wound gel, which is 4 days, versus the plain hydrocolloid wound dressing, 4.5 days, and the telfa pad, 5.2 days. There were significant differences in total wound area and contraction percentage between sites and treatments. Total wound area for the nitric oxide wound gel was lower than the telfa pad, the hydrocolloid wound dressing, and the nitric oxide wound pad. Conclusion: using nitric oxide wound dressing results in faster wound healing, as evidenced by lower total wound area and higher contraction in that group where they use the nitric oxide wound gel, and faster time to granulation tissue in the nitric oxide wound pad. Therefore, nitric oxide wound dressings are innovative and inexpensive products that can significantly decrease the amount of time and cost necessary for open or second intention wound resolution in dogs. So second intention means that you let the wound heal on its own accord. Introduction. Nitric oxide, so this is the information that matters. So for folks who are listening to this who are either veterinary students or interns, or especially if you're a resident, a surgical resident, this information is what matters to you. So nitric oxide is a small diatomic gaseous free radical that serves as a biological messenger in a wide variety of both physiologic and pathologic processes. The physiologic roles of nitric oxide within the mammalian body includes regulating the cardiovascular system, modulating host defense mechanisms in the immune system, and promoting wound healing. Conversely, pathologic processes secondary to an upregulation or downregulation in nitric oxide can result in adverse effects on cardiovascular system, progression of arthritis, cytotoxicity, organ damage, and eventual failure for patients with sepsis or a systemic inflammatory response syndrome. The role of endogenous and exogenous nitric oxide in wound healing. Once injury to a tissue has occurred, nitric oxide synthase is induced, so that's an enzyme, resulting in an increase in endogenous nitric oxide concentration. Endogenous means coming from within the body. This happens within the wound bed. In the inflammatory phase, the nitric oxide plays a significant role in chemotaxis, meaning that it attracts cells from other parts of the body to the area of concern by modulating cytokines and ushering neutrophils and monocytes to the wound. As the wound progresses from inflammatory phase, which is the first phase of the wound, first phase of wound healing for the wound, as it goes from inflammatory phase to the proliferative and then remodeling phases, nitric oxide decreases. Key roles of nitric oxide during these phases include angiogenesis, which is the stimulation of new blood vessels, via stimulation of endothelial cells, which are the cells that line blood vessels, and mediation of vascular endothelial growth factor, VEGF, and increasing collagen synthesis and deposition. Studies evaluating the impact of exogenous nitric oxide, which is outside the body, releasing wound dressings in wound healing have shown a positive impact in the face of multi-drug resistant infections in mice. Multi-drug resistance means that there's bacteria or bacterium in a wound, and that bacteria or bacterium that are there are resistant to many of the antimicrobials. Applications of exogenous nitric oxide products on burn wounds in murine, which is mice, and porcine, which is pig, models have also demonstrated accelerated angiogenesis and wound epithelialization. Epithelialization is the replication of epithelial cells, which are what make up the skin, the epidermis, thus increasing the rate of wound healing. Okay, materials and methods. All the animals had a physical exam, complete blood count, and chemistry panels. They were sedated with meropitant, acepromazine, hydromorphone, propofol, isoflurane. To create the wound, it was full thickness, 2 by 2 centimeters, removing skin, subcutaneous fat, and cutaneous trunci, and spaced 5 centimeters from each other. Nitric oxide wound pad, nitric oxide wound gel, plain hydrocolloid wound dressing, and telfa pad were tested. And then here's a chart if you want to, for those who care, who want to pause it and read that chart. That goes through the different characteristics of the wound. So what it's saying here is subjective wound evaluation scoring. Wound fluid went from none, minimal, moderate, or excessive. Fluid color, clear, pink or red, brown, yellow, green. Characteristics of wound fluid: serous, serosanguinous, sanguinous, purulent plus, purulent plus plus, purulent plus plus plus, which is liquefaction. The secondary layer: dry and clean, dry and stained, moist, less than 4 layers, wet over 4 layers and strike through. Peri-wound, either normal, edema, erythema, ulceration, induration, discoloration. Hydration, normal, maceration plus plus, desiccation plus plus, and granulation tissue, either none. Healthy red and granular, dark red and granular, purple and friable, pale and fibrous, exuberant. And so they measured the level of neutrophilic infiltration, degree of microscopic edema, necrosis, and hemorrhage. They used a histologic repair score determined as the sum of the scores for fibroblast proliferation, collagen density, and neovascularization. Results. Regarding subjective wound evaluation, the time to first appearance of granulation tissue was significantly reduced. Now they keep using abbreviations, so I have to reference these. Okay, the time to granulation wound formation was reduced with the nitric oxide wound pad, which is 3.2 days, versus the telfa. So telfa was 5.2 days, hydrocolloid was 4.5 days, and the nitric oxide gel was 4 days. And then also significantly different for the gel compared to the telfa pad. In terms of wound planimetry, total wound area, there was a significant decrease in total wound area between sites and treatments over all study days. Over all days, the total wound area for treatment with the nitric oxide gel was an average of 0.7 centimeters cubed, reduced compared to telfa, 0.9 centimeters cubed, reduced compared to hydrocolloid, 0.6 centimeters cubed, and compared to the nitric oxide pad. Total wound area for the treatment of hydrocolloid was an average of 0.3 centimeter cubed increase compared to treatment with the nitric oxide pad. Percent concentration. Over all days, percent concentration of treatment with the nitric oxide gel was 22% higher than telfa, 19% higher than hydrocolloid, 16% higher than the pad. In addition, the percent contraction of the pad was on average 6% higher than the telfa. So here is a picture showing progression from day 0 to day 21 of each one of the things they were testing. So there you go there. So that's the progression there. You can compare everything. That's why they say subjective, because this is a human looking at these and trying to characterize them. Histopathologic findings. The histopathology score on day 3 for the hydrocolloid treatment was significantly lower at 5.67 compared to the nitric oxide pad at 8.75. The scores otherwise were not significantly different on days 0, 7, 14, and 21 for any treatments. Okay, finally, nitric oxide serum concentration on day 0. The nitric oxide serum concentration ranged from 15 to 35 micromoles. The concentration on day 21 ranged from 5 to 20 micromoles. Days 7, 14, and 21, there was statistically significant decreases in the concentration compared to day 0. However, there was no significant decrease in nitric oxide serum concentrations between day 7 versus 14 versus 21 day 14 versus 21. On days 5 through 8, a decline in mean total wound area was identified for the nitric oxide gel and pad. The same decline in wound area for hydrocolloid and telfa were not identified from days 8 to 10. Discussion. Days until first granulation, percent contraction, and total wound area significantly decreased with the nitric oxide wound products compared to the standard of care dressings. There was significant decreases in the histopathology score on day 3 comparing the plain hydrocolloid versus nitric oxide wound pad, but no increases in systemic levels of nitric oxide were noted and no adverse effects. The nitric oxide wound products, either as a gel or a pad, allow for release of nitric oxide in a wound. This release occurs for several days. It's beneficial not only in the inflammatory phase, but also in the proliferative and maturation phase of wound healing when daily bandage changes may no longer be required. Endogenous nitric oxide found in all stages of wound healing, and the positive impact noted throughout this study supports the use of this product through the entire wound process for low to moderately exudative wounds. Since hydrocolloid primary layers are generally indicated with wounds expected to produce lower exudate, this wound product may not be indicated for wounds in which a large amount of exudate is to be anticipated. Furthermore, the nitric oxide releasing wound product costs $20 per application, whereas the other ones that are silver-based or collagen wound dressings are $35 to $45 per application. In the inflammatory phase of wound healing, inducible nitric oxide synthase, which is INOS, is upregulated via cytokines. So cytokines are protein messengers that will act on cells and make them behave a certain way. So inducible nitric oxide synthase is upregulated via cytokines including tumor necrosis factor alpha, interferon -Y, interleukin 1b. Once inducible nitric oxide synthase is upregulated, it allows for increased production of nitric oxide. A negative feedback loop regulates inducible nitric oxide synthase, which is time dependent, with increases in inducible nitric oxide synthase resulting in upregulation of cytokines that act to decrease the expression of inducible nitric oxide synthase in the inflammatory phase of wound healing. So that way, this enzyme is kept in check. An exogenous source of nitric oxide applied to the wound bypasses nitric oxide formation, allowing nitric oxide to act as a pro-inflammatory mediator by modulating chemoattractant cytokines and attracting neutrophils and monocytes, but also functions beyond the constraints of the negative feedback loop because you're giving it exogenously, thus allowing for an increased concentration of nitric oxide in the wound bed. This is postulated to be the cause as to why time to first granulation tissue was significantly shorter for the nitric oxide pad compared to other treatments, and the gel compared to the telfa group. Decreasing the time in which phagocytic cells migrate to a new wound bed with exogenous nitric oxide could allow for earlier phagocytosis via neutrophils and activation of monocytes into tissue macrophages, thus resulting in expedited propagation of granulation tissue formation. With the nitric oxide pad treatment, they had a significantly shorter time to first granulation tissue. Statistically significant for time to first granulation tissue was not achieved in the gel group compared to the hydrocolloid group, but was significant compared to the telfa group. Although both nitric oxide pad and gel release nitric oxide, a large distinction is noted in the delivery of nitric oxide between the two treatments. Also keep in mind they only had 6 dogs in the study, so it is a weakness of this paper they only had 6 animals, so these comparisons are based on low numbers. The accelerated time to first granulation tissue of the pad is likely multifactorial, acting as an adherent contact layer, aiding in debridement in addition to the effects of nitric oxide. Within this study, in addition to an accelerated time to first granulation, percent contraction, and total wound area, were significantly impacted. Total wound area was significantly decreased with the gel group compared to other treatments. For the pad group, total wound area was significantly decreased compared to hydrocolloid. The significant decrease in wound area, total wound area across the study days with the gel treatment is likely because of enhanced angiogenesis and collagen deposition from the exogenous nitric oxide within the wound bed. Studies have identified the role of nitric oxide as it relates to angiogenesis and collagen deposition, key components of the proliferative and maturation or remodeling phases of wound healing. Vascular endothelial growth factor, VEGF, plays a pivotal role in angiogenesis, and neutralization of VEGF has been shown to decrease granulation tissue. Nitric oxide increases VEGF expression in keratinocytes, which are the primary producers of VEGF. Also, VEGF stimulation of endothelial cells and cell migration are also dependent on nitric oxide. In murine and porcine models, proangiogenic effects following nitric oxide topical products on wounds have been documented as a result of the impact of nitric oxide on VEGF. Other studies have demonstrated increased collagen synthesis, collagen deposition, reepithelialization from exogenous nitric oxide. The percent contraction of the gel treatment was significantly increased compared to other treatments. Also, the pad treatment had a significant increase in percent contraction compared with the telfa treatment. These results, in consideration with the impact of enhanced angiogenesis, suggest nitric oxide promotes fibroblast activity and collagen synthesis, deposition, and reepithelialization at a faster rate in dogs than the standard treatments used. And in this study on day 3, they found a significant decrease in histopathology scores with the hydrocolloid group compared to the nitric oxide pad group. Nitric oxide concentration baselines were higher in this study compared to other studies. Throughout this study duration, nitric oxide concentrations, this is serum, did not increase above baseline, concluding that systemic absorption of nitric oxide from the wound products were negligible. There was a noticeable decrease in wound area on days 5 for both the pad and the gel. In contrast, the same decrease in wound area was not noted until day 8 for either hydrocolloid or telfa. Similarly, with respect to percent contraction, a visible increase was observed on day 5 for both the pad and the gel, with the same increase not being seen by day 8 for the other treatments. The clinical significance is that smaller wound area with a larger percent contraction would allow for delayed primary closure. So delayed primary closure means you wait a little bit before you surgically close the wound, as opposed to closing the wound right away when the wound is created, or secondary closure sooner than with the standard of care dressing. The reported mean concentration of endogenous nitric oxide in dogs is about 10 micromoles, but in this study they were on average more than that. I think it was like 15 to 30. And so external factors such as exercise and increased shear stress in the vascular system can increase endogenous nitric oxide in circulation. Throughout the duration of the study, there was significant decreases in nitric oxide concentration on days 7, 14, and 21 compared to baseline on day 0. These decreases could be attributed to increased stress on day 0 than compared to the rest of the study. So in conclusion, this study found that nitric oxide accelerated the wound healing process via promoting earlier granulation tissue formation, increasing the rate of percent contraction, and decreasing total wound area when compared to standard of care, decreasing both the amount of time necessary for wound resolution and overall costs. So for veterinarians, if you're dealing with a wound that's giving you a hard time healing, you could look into nitric oxide type products. And for pet owners who are going back and forth with their veterinarian and having difficulty with some chronic wound, you can inquire about nitric oxide wound beds and then have your veterinarian look at the study to get some data. Because again, this is experimental, it's a controlled environment, only 6 dogs that are otherwise healthy, so we still need more studies for this, but overall useful information. All right, we'll see you guys in the next video. Thanks.